7 heart medications that trigger hormonal changes and muscle loss. If you think your heart medication is safe, think again. It might be destroying you from the inside. Did you know the very pills prescribed to save your heart might be secretly stealing your strength? It sounds unbelievable, but medical research confirms this disturbing truth. Some of America's most commonly prescribed heart medications can silently trigger hormonal chaos and muscle wasting in seniors. Today, we're pulling back the curtain on this hidden health crisis affecting millions. What your doctor never told you about heart medication might shock you. Millions of seniors are experiencing unexpected side effects that silently change their quality of life, from hormonal disruption to concerning muscle loss. These aren't rare complications. Research shows they're happening to thousands of patients taking 7 common heart medications right now. Did you know that over 70% of Americans aged 65 and older take at least one prescription medication for heart health? While these medications save lives, they can sometimes cause problems we don't immediately connect to the pills we're taking. Medication number 1. Beta blockers. Beta blockers like metoprolol and propranolol are often prescribed for high blood pressure and heart rhythm problems. These medications work by blocking certain hormones that affect your heart. A 2023 study published in the Journal of Cardiovascular Pharmacology found that long-term use of beta blockers can lower testosterone levels in men by up to 28%. For women, this can affect estrogen balance. What you might notice: unusual fatigue, decreased muscle strength, and sometimes weight gain around your middle. One patient in the Cleveland Clinic study reported losing nearly 15% of his muscle mass after 3 years on high-dose beta blockers. If you're experiencing these symptoms, don't stop your medication, but do speak with your doctor about adjusting your dosage or trying an alternative. Medication number 2. Statins. Statins like atorvastatin, Lipitor, and simvastatin, Zocor, help lower cholesterol. They're among the most commonly prescribed medications for seniors. Research from the Mayo Clinic in 2024 showed that approximately 10 to 15% of statin users experience muscle problems. These range from mild soreness to serious muscle breakdown. What many people don't realize is that statins can interfere with your body's production of CoQ10, a compound your muscles need to function properly. The American Heart Association confirms that this depletion can lead to muscle weakness, especially in adults over 65. Signs to watch for include muscle pain, weakness particularly when climbing stairs, and unusual cramps, especially at night. Medication number 3. ACE inhibitors. Medications like lisinopril and enalapril help relax blood vessels. They're excellent for managing blood pressure, but they can affect your body's hormone balance. A comprehensive study from the University of Michigan in 2023 found that ACE inhibitors can increase levels of a hormone called bradykinin in your body. This hormone change can cause a dry, persistent cough in about 20% of patients, but it can also lead to subtle changes in how your body handles sodium and potassium. These mineral imbalances can weaken muscles over time. If you've noticed increasing weakness since starting these medications, especially in your legs, this could be why. Medication number 4. Diuretics. Water pills like hydrochlorothiazide and furosemide help remove excess fluid from your body. They're often the first choice for treating high blood pressure and heart failure. Johns Hopkins Medicine researchers found that these medications can cause significant loss of potassium and magnesium, minerals your muscles need to function. Their 2024 study showed that nearly 30% of seniors on diuretics had muscle weakness related to these mineral losses. Even more concerning, long-term use can affect your body's insulin response, potentially leading to higher blood sugar levels and further muscle problems. Warning signs include muscle cramping, irregular heartbeat sensations, and increased thirst. Medication number 5. Calcium channel blockers. Medications like amlodipine and diltiazem help relax blood vessels by blocking calcium. They're excellent for blood pressure control, but can have hormonal side effects. Research published in the European Heart Journal in 2022 showed that these medications can alter testosterone metabolism in men and affect estrogen pathways in women. For some patients, this led to a 5 to 8% reduction in muscle mass over a 2-year period. If you've noticed breast tenderness in both men and women, muscle fatigue, or changes in your energy levels, talk to your doctor about these potential effects. Medication number 6. Angiotensin II receptor blockers, ARBs. Medications like losartan and valsartan are newer options for blood pressure control. While generally well tolerated, they're not without hormonal effects. A study from Vanderbilt University Medical Center found that ARBs can affect your body's aldosterone levels, a hormone that regulates salt and water balance. This hormone change was linked to muscle weakness in about 8% of study participants over age 70. Pay attention to unusual dizziness when standing up, increased fatigue during normal activities, or new muscle aches in your legs and arms. Medication number 7. Anti-arrhythmic medications. Medications like amiodarone and sotalol control irregular heartbeats. These powerful drugs can significantly impact your thyroid hormone function. Research from the American Thyroid Association shows that amiodarone, in particular, causes thyroid problems in up to 15% of patients. This hormone imbalance directly affects muscle strength and metabolism. Warning signs include unexplained weight changes, extreme fatigue, muscle weakness, and feeling unusually cold or hot. What you can do. First, never stop taking your heart medication without talking to your doctor. The benefits often outweigh these potential side effects. Here are practical steps you can take. Keep a symptom journal. Track when you notice muscle weakness or changes in energy levels. Ask about medication alternatives. Sometimes switching to a different drug in the same class can help. Request regular blood tests. Hormone levels, potassium, magnesium, and thyroid function should be checked periodically. Consider supplements, but only with your doctor's approval. CoQ10 may help with statin-related muscle problems, while potassium and magnesium supplements might benefit those on diuretics. Increase physical activity gradually. Even light resistance exercises can help maintain muscle mass. Remember, these medications save lives every day. The goal isn't to frighten you away from taking them, but to help you recognize potential side effects so you can work with your doctor to find the best balance for your health. If you're experiencing unexplained muscle weakness, fatigue, or other new symptoms, don't dismiss them as just getting older. Talk to your healthcare provider about whether your heart medication might be playing a role. Your heart health is important, but so is your overall quality of life. With the right information and medical partnership, you can protect both.